Magandang araw sa inyong lahat. I'm Andy Mamayok from Basn 1, Maslow. So now we're discussing about ethical issues in health education. From a profession point of view, ethical behavior is expected from professionals. Ethical conduct is particularly important for health educators since they are working with a mission to serve the individual. So, ethical behavior is expected from professionals, especially those in fields like health education, since they are working to serve the individual, and also ethics ensures professional act in way that benefit individuals and society. Example, a doctor maintaining patient confidentiality so that the doctor is not only who benefit to that ethical behavior but also the patient. Here is the definition of ethics. Ethics is the philosophical study of the moral values of human conduct and the rules that govern it. It is the right thing to do for society and self. Ethics is the study of morality focusing on the rightness or wrongness of human actions. It also includes rules that guide how people should behave in that society. Example, not cheating on exam or in business dealing. In that scenario, you know that rules in the classroom and to yourself also na malaman na cheating is morally wrong. Another example is following laws such as stopping at red lights. Moral refers to those beliefs about how people ought to behave. It is refers to individuals or cultural belief about what is right and wrong. Example, some culture believe in vegetarian as an ethical choice kasi in that culture maybe they believe that killing animal is wrong so that ang alternative food nila is plant-based. Another example is helping the elderly is seen as morally right in many societies. Thank you.
Good day, my name is Erica Tricia Peranya from BSN1 RM. So here are the basic ethical principle. The first principle is the principle of autonomy. These principles means the people, being individuals with individual differences, must have a freedom to choose their own ways and means of being moral with the framework of other four principles. Respect for autonomy involves respecting others' persons' right and dignity such that a person reaches a maximum level of fulfillment as a human being in the context of health promotion and healthcare. This means that the relationship between health extension workers and community member is based on respect for him or her as a person and with individual rights. So these principles emphasize that the health extension worker should engage with community members in a way that value their opinion, preferences, and decision regarding their health and well-being. Autonomy acknowledges that the patient are individual with unique value, belief, and preferences. It means treating them with dignity and allowing them to make a choice that align in their own good. Rights in relation to health care are usually taken to include the right to inform. This means the patient have the right to receive clear and understandable information about their health condition, treatment option, risks and benefits before making any decision about their care. Next, the right to privacy and confidentiality. Patients deserve to keep their health information secret. This is called the right to privacy and confidentiality. It means doctors, nurses, and other healthcare workers can tell anyone about their patient health problem or treatment. Next, the right to appropriate care and treatment. Good healthcare or treatment means doctor and nurses know what they are doing. They should also keep the patient safe and try not to hurt them. It's important that they explain things clearly so that the patient understands what's happening.
Good morning, sir. I'm Queenie Andal Upam from BSN1 Orem. So my topic is one of the basic ethical principles, the beneficence or doing good. So beneficence means doing or promoting good as well as preventing or removing and avoiding evil or harm. So basically, mahalin tulad natin ang beneficence to having an empathy with our patients or in our surroundings. So, ang example natin dito is providing information about emergency first aid to reduce the risk of HIV infection or incident. So, as a nurse, it is our obligations to provide care to our patients and as well as promoting health education as well. So katulad dito, sa example natin, nag-promote tayo ng information about the emergency first aid para mabawasan or maiwasan natin yung pagkakaroon ng HIV infection. So in beneficence, it's really important that we have sympathy and empathy because if we possess those attributes or acts within ourselves, may isip natin kung ano ang makakabuti sa iba, especially to our patients. Because as a nurse, we are provider of care, a caregiver, educator, as well as advocator.
Hi everyone, I am Micaela Ledesma from BSN1 Orem. For my part, I will tackle about one of the important principles of nursing ethics, the non-maleficence or doing no harm. Basically, ano yung non-maleficence? Non-maleficence holds a central position in the tradition of medical ethics and guards against avoidable harm to subjects. In short, it refers to non-infliction of harm to others. So, non-maleficence is a big word, pero it basically means do no harm. Parang yung basic rule na huwag kang manakit. In the world of medicine, it's super important. It's about doctors and nurses making sure na yung ginagawa nila hindi makakasama sa patient. It's not just about physical harm ha. It's also about avoiding any kind of harm like emotional and psychological harm. So let's go deeper. Doing no harm, it means before doing anything, dapat iniisip ng mga medical professionals yung possible risks. They have to weigh the benefits versus the risks. Dapat yung benefits mas malaki kaysa sa potential harm. Yung example ng use of sterile needles. This is a very practical example. If you use dirty needles, you can spread infections. By using sterile needles, you're preventing harm to the patient. It's a basic practice but super important. So again, non-maleficence is about being responsible. Before we do anything, we need to think about the possible consequences. We should always aim to prevent harm to others. Thank you.
Okay, so our next principle is justice or fairness. So this principle states that human beings should treat other human beings fairly and justly in distributing goodness and badness among them. So, ang justice o fairness ay tungkol sa pagiging patas sa pakikitungo sa ibang tao. Ibig sabihin, kung may kailangan ipamahagi, mga benepisyo man o consequences, dapat ito ay pantay at makatarungan. Hindi pwedeng may pinapaboran lang dahil sa status, pera o koneksyon. So, in other words, justice should include, first is fair distribution of scarce resources. So, kapag limitado ang isang bagay, dapat itong ipamahagi ng patas at base sa pangangailangan. So, for example, sa isang hospital, kung kulang ang ventilators, hindi pwedeng unahin lang ang mayayaman o may kilala sa loob. So, dapat ibigay ito sa mga pasyenteng mas nangangailangan tulad ng mga critical ang condition. So, second is respect for individual and group rights. So, dapat igalang ang karapatan ng bawat isa kahit ano pa ang estado natin sa buhay. So, for example is sa trabaho. Hindi dapat mabypass ang deserving na empleyado sa promotion dahil lang sa favoritism. So, kung sino talaga ang may skills at effort, siya dapat yung ma-promote. So, lastly, is following morally acceptable laws. So, ang mga batas na sinusunod natin ay dapat patas at makatarungan para sa lahat. So, example is yung libreng edukasyon sa public schools ay isang anyo ng justice dahil binibigyan nito ng pantay na opportunity ang lahat ng students, mayaman man or mahirap. So, in short, ang justice o fairness ay hindi lang basta pantay-pantay, kundi siguraduhin na ang bawat isa ay nakakakuha ng nararapat para sa kanila. Kasi kung unfair ang system, nagkakaroon ng discrimination at kawalan ng opportunity sa iba.
Hello everyone, I'm Kyla Emma Migala from BSN1 Maslow. So today I'm going to report about the principle of truth-telling, honesty. At the heart of any moral relationship, there is a communication. A necessary component of any meaningful communication is telling the truth, being honest. So the principle of truth-telling, honesty means that honesty is fundamental part of any moral relationship. Binibigyang diin nito ang kahalagahan ng pagsasabi ng totoo sa komunikasyon upang mapanatili ang tiwala, integridad at etikal na pakikitungo sa iba. Ang pagiging tapat ay nangangahulugan ng hindi panlilinlang sa iba, pagbibigay ng tamang impormasyon at pagiging bukas sa mga ugnayan, maging ito man ay personal, professional o panlipunan. Sa larangan ng etika, mahalaga ang pagsasabi ng katotohanan, lalo na sa mga profesyon gaya ng medisina, batas at pamamahayag kung saan ang katapatan ay may direktang epekto sa mga karapatan, desisyon at kapakanan ng tao.
Hello everyone, my name is Samrada H. Pendatun, and today I will be discussing the ethics for the performance of health extension workers as health educators. So let me begin by explaining who health extension workers are. Health extension workers are healthcare professionals who serve in rural or underserved areas. They are tasked with promoting good health practices and providing healthcare services, especially in places where access to hospitals or clinics is limited. They work closely with local communities, particularly in barangays or remote villages, where health services are often scarce. Health extension workers, as health educators, assume profound responsibility in using educational processes to promote health and influence human well-being. They are also responsible for the implementation of health extension package program. Ethical precepts that guide these processes must reflect the right of individuals and communities to make decisions affecting their lives. According to the passage, health extension workers assume an important responsibility in guiding and educating people about health issues. They use educational processes to promote health, aiming to influence human well-being positively. As health educators, they don't just provide information because they help individuals and communities understand how to make informed decisions about their health. However, these efforts must be based on strong ethical principles. These principles guide their actions and ensure that the people they work with are treated fairly, respectfully, and are empowered to make choices about their own lives. In other words, it's essential for health extension workers to respect the rights of individuals and communities. This means acknowledging that every person has the right to make decisions about their health free from coercion or pressure. Additionally, HEWs are responsible for implementing health extension programs. These programs aim to deliver essential health services and education to the community. When carrying out these programs, it's important for HEWs to adhere to ethical standards. This ensures that their work is both effective and morally responsible.
Hi everyone, I am Zubaya Mkusa and I am from BSN 1 Maslow. So I will report about health extension workers' responsibilities as a health educator. So, affirm an equal right, believing that health is a basic human right for all. Health extension workers believe that everyone has the right to good health. They advocate for policies and practices that promote health equity. For example, they might work to ensure that everyone has access to affordable health care regardless of their income or background. So next, provide people with relevant and accurate information and resources to make their choices freely and intelligently. So they provide people with reliable information and resources to make informed decisions about their health. For example, they might teach people about the benefit of healthy eating or the importance of regular exercise. They could also provide information about specific health conditions such as diabetes or heart disease. Next, support change by freedom of choice and self-determination as long as these decisions pose no threat to the health of others. They encourage people to make choices that are best for their own health, as long as these choices don't harm others. This means respecting people's autonomy and supporting their right to self-determination. For example, they might help someone to quit smoking or to lose weight, but they would do so in a way that respects the individual's own choices and decisions. Next, be advocates for healthful change and legislations and speak out on issues deleterious to public health. They work to improve health policies and legislation, speaking out against issues that threaten public health. This could include advocating for laws that restrict smoking or promoting policies that increase access to health care. Last one, avoid and take appropriate action against unethical practices and conflict of interest situations. They take actions against unethical practices and conflicts of interest that could harm people's health. For example, they might report a healthcare provider who is engaging in fraudulent activities or who is putting patients at risk.
Hello everyone, I'm Haran Mantil. So I'm going to report the last part. Respect the privacy, dignity, and culture of individual and community and use skill with these values. So we need to respect others, treat people with dignity and honor their privacy, cultural background, and values. The second one is share their skills, experience, and vision with their client and colleague. Like sharing knowledge or helping others by sharing your experience and skills with clients and colleagues. The third one is observe principle and informed consent and confidentiality of individual. We need to ensure consent and confidentiality, like getting their permission before taking action that can affect other and personal information private. The fourth one is maintain their highest level of competence through continuous study, training, and research. We need to keep learning, continue improving our knowledge and skills through education and research. And the fifth is accurate represent their capabilities and education as well as their training and experience, and act within the boundaries of their professional competence. So we need to be honest about our ability, represent our qualification truthfully, and only work within your area of expertise. And the last one is we need to avoid discrimination. Do not exclude or treat people unfairly based on factors like gender, age, race, social status, and other personal attributes. Thank you.